we would like to share our modified scuba technique for DMEK preparation. Here's a view of the supplies used during this procedure. The procedure will take place mostly on a Moria deep well vacuum punch block. Generally, 2 diameters of guarded tree fines are used, disposable curved tying forceps, an angled DMEK S marker, and a Sinskey hook, all made by Moria, are also used during this procedure. Additionally, we'll use a 2.5mm biopsy punch, balanced salt solution, trypan blue, a skin marker, gauze, and surgical spears. To begin, the cornea is placed endothelial side up on the Moria deep well vacuum punch. The 4 cardinal holes aid in centration, as does the peripheral groove. When the technician is confirmed that centration is ideal, suction is applied through the center holes as well as a peripheral groove that all work together to prevent the cornea from shifting during the delicate trephination and scoring procedure. A guarded punch is used to perform a partial thickness trephination to ensure that Descemet's membrane is broken 360 degrees. Following partial thickness trephination, the balanced salt solution is dried and trypan blue is applied for staining the endothelium. This helps the technician visualize the edges of Descemet's membrane. BSS is reapplied, and the operator will begin the delicate procedure of establishing the plane between Descemet's membrane and the residual stroma. Note how the technician slides the tip of the Sinskey hook rather than pulling. This helps minimize any tearing of the delicate Descemet's membrane. In order to minimize the risk of any tearing during the actual peel of Descemet's membrane, it is critical that the technician ensure full breakage and separation of Descemet's membrane 360 degrees around the trephination zone. After the partial separation of Descemet's membrane a full 360 degrees, the disposable Moria curved tying forceps are used to initiate a slow, controlled, gentle peel of Descemet's membrane from the stroma. If suction has previously been applied, it will be removed prior to this step. The peel is completed 80 to 90%, leaving a peripheral hinge where stroma and Descemet's membrane are still adhered. With Descemet's membrane and endothelium off to the side, a 2.5mm biopsy punch is used to create a stromal tunnel through the exposed stroma. This will allow access later to Descemet's membrane so that an orientation mark can be applied using Moria's angled DMEK S marker. Once the stromal tunnel has been created, the membrane is returned to its anatomical position. Excess moisture is dried so that the graft adheres back to the stroma. The graft is flipped over and the stromal plug that was just created with the biopsy punch is removed to provide access to Descemet's membrane. Any residual balanced salt solution is removed to provide a dry surface so that the ink will transfer from the S mark to Descemet's membrane. Allowing the tip of the S mark to maintain contact with Descemet's membrane for a few seconds will optimize the amount of ink that is transferred to Descemet's membrane, ensuring a crisp, bold S mark. Following completion of the S mark, the stromal plug is returned. In preparation for a second punch, The operator may find it helpful to mark the blade of the trephine with a skin marker. They will lightly press it on the cornea block, thus creating a new target for centration that allows proper alignment of the newly created S mark. The second punch is done with a guarded trephine as well, much in the same fashion as the first punch. The technician will want to ensure that the graft has been fully cut 360 degrees at the requested diameter of the operating surgeon. The graft is inspected for total trephination before carefully removing using the disposable Moria curved tying forceps. Now that the graft has been completely removed, if requested, it will be stained with trypan blue and make its way to the operating room for transplantation.